So this is the COVID update for February 16th. Next slide, please. As we are kind of hitting through several firsts in the next couple of months, it was February 11th that the WHO named it as actually COVID-19. So that's a little piece of your COVID history to start this one off. Next slide. All right, looking at the U.S. Picture, we can see that U.S. cases are down in the last 2 weeks from the previous 2 weeks, which is a good sign. There was a slight increase in deaths from the previous 2 weeks, but as it follows that 2 weeks for cases, 2 weeks for hospitalizations, potentially 2 weeks for deaths, that's not to be unexpected. Next slide, please. All right, here's our state of Kansas update. I think that is probably one of the lowest 2-week case updates for the state that I have seen in the last several months as well, with 10,000 new cases in the last 2 weeks. Next slide. For the Saline County overview, we are sitting at 5,800 cases. The big thing I want to make a note of and point out here is that after several weeks of the hospital being inundated with COVID patients, as of yesterday, they were down to 8 patients in the hospital, which is, I think, the lowest number we've seen of COVID patients in the hospital probably since October. So again, all the indicators are really looking better as we're moving forward. Next slide. Same thing with cases in Saline County. You can see here that our case numbers for the month of February are about 292, much lower, for the mid-month point than what we experienced even last month. So again, trending in the right direction. Next slide. Same with deaths. We've only had 3 this month, in the month of February. Again, trending in the right direction. Next slide. Clusters still continue, and some of that is just from the extent of dealing with those clusters and whether there's another case associated with it. My hope, though, that as we are now really drawing down on cases, that we'll be able to start closing out some of these clusters that may have been sitting in the state system for a little bit. Excuse me, next slide. For testing, so testing is still occurring, and at the Church of the Cross with Well Health, and as I've said in the past, you can go to the website gogettested.com to find a time and get registered if you want to be tested. In the month of January, there were some testing events that still occurred. One of the questions that comes up is, are the numbers that we're seeing of cases going down because cases are going down or because there's less testing? And I think there's a little bit of both there. Even though there is less testing that's been happening, there's also been a decline in demand for testing outside of going to your provider. But one of the things in looking at the results, or the batch results coming from Well Health and from CRL, which is the lab that was running the test for some of the other mass testing clinics last month, is that even with a decrease in demand for testing, the percentage of results coming out of those batches of results were much smaller too. So in the neighborhood of less than 10% of all the results were coming back positive. So that's a good sign for as we're moving forward into the end of winter and into spring. Next slide. So vaccine updates, this is probably still what most people want to know about. These are our current phase 2 priorities. We've reached that 30% of those over 65. And so we're working through first responders, K through 12 staff and child care workers, those that are city and county and critical infrastructure. And again, if you fall into a phase 2 category, which later on is the definition and breakdown of that category, and you have not registered yet and you want to get vaccinated, please go to the vaccinatesalinecountyks.com and get vaccinated. One other thing as well is on that website, when you get called for your appointment, you can go to that website and print off your consent paperwork that you need to fill out prior to going there. Now, if you don't have the paperwork prior to showing up for your appointment, that's fine. You can fill it out on site. That's not an issue. But this helps speed things up if you have it filled out already ahead of time. If you want to see how we stack up week to week about how much vaccine we are receiving compared to other counties, the kansasvaccine.gov website has that comparison week to week about how much each county is being allocated. On the horizon, though, the new Johnson & Johnson vaccine is a one-dose vaccine that goes up to the in front of the FDA on the 26th to be reviewed. And then some weeks after that, if it's approved, we could start seeing that as an additional available option besides the Pfizer and the Moderna. I don't have much information about what kind of requirements they may have if they decide that they are going to direct it to specific types of groups or whatever the case may be. But just know that there is that on the horizon for it, another option or another tool in this fight moving forward to combat COVID. Next slide. So I also wanted to kind of mention a minute, because there are vaccine that has been coming into the county in more than one way. One of them was the National Pharmacy Program for Long-Term Care. That was the vaccine that was coming from the federal administration down to the nursing homes through CVS and Walgreens. And most of those have already received both their first and second shots. So that one is pretty much complete. The bulk of our vaccine right now is coming from allocations from KDHE to local health departments. And that is the current supply that we are using to give to people at the joint vaccination clinic at the JCPenney building. And then there's also the new stream that is the federal retail pharmacy program. Right now in the area, 2 of the local Dillons are part of that. They're only doing over 65. I think they are maybe getting about 100 per week potentially. But if somebody over 65 wants to try and register that way to get their vaccine, the website is listed right here. And from what we are being told, the feds intend to bring more pharmacies over time to this program, such as Walmart, CVS, Walgreens, and several other chains. The one thing to keep in mind about both the National Pharmacy Program for Long-Term Care and the Federal Retail Pharmacy Program is that those are coming from federal allotments of vaccine and do not impact the allotment that we receive. So that's in addition to what we are already getting. So like this week, we got 900 doses to be able to give, and then whatever the 2 Dillon's pharmacies get is on top of that. So that's a bonus for our community, and it also puts us a little bit further ahead at trying to get everybody vaccinated. Which, as of Friday, we have had over 5,500 people that have received either one or both vaccines. And like I said, we have 900 scheduled for this week, and we have 900 new ones scheduled for next week. And one of the things I really want to point out is that is going to be about 15% of the adult population that's been vaccinated. But more importantly, is that will now, there will be more people that have received one or both doses of vaccine that have had COVID in the county since the beginning of the pandemic. So that's just something that we want to be able to celebrate. And again, bright lights looking forward as far as maybe one day getting out of this pandemic and everything else. Next slide. So if people are looking for where to find where vaccine is being given at, this is for information. So on the kansasvaccine.gov website, excuse me, is this new tool that KDHE has built. It's called Find My Vaccine. Whether they're looking to see if there's vaccine here or somewhere else around the state, this screenshot shows that you can be able to look at an area say within 50 miles or 5 miles or 10 miles or wherever you're at, see what places are providing vaccine, and what information and how to register for vaccine at that site. This is still something that's new that they have been developing, so that there are still some sites that may be giving vaccine that aren't on here yet, such as the 2 Dillons are not on this site yet and clickable. However, I expect as other pharmacies come on board, we will see that showing up on there. Next slide. So probably one of the things that everybody should be excited about is, do you have to quarantine after you are fully vaccinated? And the answer is no, you do not, provided you meet these criteria, so that you've had both vaccines and it's with 2 weeks after your second dose. That means that you're fully vaccinated. You're exposed to somebody with COVID-19 within 3 months of your last dose, and you have remained asymptomatic since that exposure. KDHE is updating their guidance now to match that. If you want to read more about it, the link is listed down there below. But if anything, if somebody was wondering whether they should get vaccinated or not, this is a good incentive, because then you don't have to worry about quarantine after the fact. Next slide. So I left these next couple of slides in here. It just breaks down again the vaccination phases. And we are in phase 2 and probably will be in phase 2 for quite a while. There's a lot of people that fall into that phase. Next slide. And again, these definition slides are just there for information. These are what congregate settings, and we'll be working down through them eventually. Next slide. The high contact critical workers. Next slide. And if you want to know where to find information, we've got several places for you to be able to do that. The newsletters, the VaxFacts that goes out, KSAL, KINA. We're putting up all kinds of stuff on our social media routinely. We filmed the second installment of FAQ Friday the other day, and it's up on the YouTube page on Media Connection. And of course, the Saline.org coronavirus page has links on there as well. And as always, if this doesn't solve the question that you're looking for or doesn't answer it, then please reach out to us and we will try to get those questions answered for you. You can reach out through email or directly through Facebook or one of those social media avenues. Next slide. So to the major unknown still is the COVID variants. You may have seen the news report yesterday about the second case of the UK variant that has been found in the state, in Sedgwick County. And that UK variant is that B117 that you see up there at the top, which has now been reported in 40 states. And that's really the unknown thing that we're watching right now. We really don't know how that's going to impact things. A recent article from the CDC mentioned that the UK variant could be the predominant variant floating around or in circulation by March. But there's just not a lot of additional information yet as far as how that's circulating, and if there are more cases, which I suspect there probably are, but that information is still limited because they are only doing genetic sequencing on a small sample of tests that are sent to KDHE. So as that continues to change, we'll be continuing to watch that and put that information into our overall decision making. Next slide. Some of you also may have heard talk about double masking. So I've provided some information up here about some reasons why the CDC talks about double masking for improved fit or improved filtration, depending on the type of mask that you're using. There is a link there to the study that this information came from, if you want to read further into it. Additionally, at the bottom of that slide is a link to the CDC page where this information came from, which also goes into some more detailed information about how to properly wear your mask, the different types of masks, and those types of things. We are not planning to pursue anything about double masking as far as within our mask orders right now. I think we just need to continue focusing on everybody masking and masking properly. And then this is an additional option for those who feel like they need it at this point. Next slide. So that concludes the COVID update for February 16th. And I will, if there are any questions.
Jason, this is Commissioner Vidrickson, and I had a few questions, but you've pretty well taken care of them. One is left here, though, on when Dillon's and Walgreens, et cetera, and are those closed to out of county, or is there any way to check that, or does that count against our county count, or do they just open it up for anyone, or how does that work?
So the understanding I have right now is that the state has put the primary group, the focus group, was those over 65. The state has not, to the best of my knowledge, made any type of residency requirement. So theoretically, anybody from a neighboring county could register through one of those pharmacies and come get the vaccine. And being that it's a federal program, we don't have very much control over that part of it.
Does that residency restriction also apply for the KDHE? In other words, if someone goes through your organization or through Saline Family Physicians and so forth, and they are not from Saline County, how do we exclude them, or how?
So our primary focus has been those that live and those that work in Saline County. We have a lot of people that work here that may not necessarily live here, but they are important to the infrastructure, and they fall into those groups. When on the registration process, if you'll remember, it does ask for their address, and it also asks if they live and work in the county. And that is part of the sorting process when we are going through all of the registrations.
Thank you.
Commissioner Weiss here.
Yes, sir.
I got a couple questions. Do you know do you have a total count of the K through 12 people who would be eligible?
I have an estimate.
Or just get me close.
Let me see here a second. As of last week, it was around 900 K through 12 and child care providers that had registered. Now, I'm sure that there are many more that are eligible that, for whatever reason, haven't registered. And for that number of K through 12 and child care providers, there were many of them that fell into the over 65, so that doesn't count them because they're already in the primary group. Does that make sense?
Yeah, I was wanting to know, and I wanted that number also, but I was trying to wrap my head around how many are eligible, and you don't have that through USD 305 or anything, what their staff would be.
Well, they at one point were trying to collect some of that information, but it wasn't, as far as trying to give us specific numbers per building or anything like that, there wasn't anything that we could do with it. So no, I haven't collected that specific information about how many of them wanted to get vaccinated per school district.
The question wasn't how many wanted to, the question of how many are eligible to.
As far as how many eligible, I don't know. I would have to find out from each school district how many would fall into that eligibility.
And do you know the number of 65 and over who are currently on the list?
Let me see here. I think we still have about if I'm reading this right, about 3,500 still to get vaccinated.
Okay. And as you go through that phase 2, you have different categories, whether they're K through 12 or over 65 or over or whatever. How do you take a percentage of the doses that are allotted and then dole them out?
Right. So for the current groups right now, like for the ones that we're giving this week, the ones that we're giving next week, we did a 50-50 split. 50% went towards the over 65. About 35%, give or take, went toward that whole K through 12 and child care providers. And then the other 15 to 20% went toward the first responders, fire, law enforcement, those critical city county workers. And then actually, we will have probably that same breakdown for the next week. And then as we get through a majority of those groups, we have been talking about how to tackle the rest of the different groups within the breakdown, because they are varying numbers. And so as we get through the next couple of weeks, but we're meeting weekly about how we are, what percentages and how we're trying to get through these, all these different categories.
Okay, with that information then, Jason, if the 900 doses a week hold and you're given 30% of that to K through 12, in approximately 3 weeks, you will have K through 12 vaccinated?
Approximately, sir, yes.
Okay, thank you.
Mm-hmm.
Any other questions or comments?
Jason, this is Commissioner White.
Yes,
I had the privilege of going out to J.C. Penney's. That was last week, and I was really impressed. Staff was very knowledgeable and explained the process and where to go and what to do. And everybody had such a good attitude, and you could, even though everybody's wearing their mask, you could still see them smiling. So they were enjoying what they were doing, and I want to commend you and your staff and your partners on a well-done clinic.
well, thank you, sir. I'll pass that along to him.
Thank you.
Okay. Any other comments? So thank you, Jason, for that update.
Mr. Chairman?
Yes.
We do have a hand raised.
Okay.
Lene Meyer?
Yes, Jason, I just wanted to clarify, and I may have missed you saying this, but it's my understanding, or I've read that even after you've had both vaccines, even though over 2-3 weeks, then you're not having to quarantine, but it's my understanding that we still should be wearing the mask and social distancing when we do go out. Is that correct information? And maybe you said that and I missed it.
No, I didn't, but that is correct, ma'am. Even after being fully vaccinated, you still have to wear a mask, you still need to social distance, and that will probably still go on for quite a while until we get a majority of the population vaccinated.
Okay, thank you.
You're welcome.
Thank you, Lene.
You saw all the data in the previous presentation. And while I'm confident that we are getting closer to a point, you know, the light is at the end of the tunnel, as we say, but we're not quite to the end of the tunnel yet. I think it would be premature to let our health order expire on February 21st. I do think, though, that we are definitely in a position where we could loosen up some of the restrictions that we've had in the order. So right now, my current thoughts are that to plan to issue another order on February 22nd after the current one expires. But given the improvements that we have seen, raise the mass gathering limit from 15 to 50 individuals, and then also raise the percentage that's listed in section 2, number 5, about auditoriums and exhibit halls, and raise that from 25% of capacity to 50% of capacity. And then have the new order in place for an additional 4 weeks that would expire on March 21st. A couple of additional reasons is that would also give us time to get a greater number of the population vaccinated. If we start to see increases in cases after raising this limit, it's easier to make changes than it is to try and react an entire new piece of health order. And then also to be able to really kind of get a better sense of what's happening with the COVID-19 variants in the state and in the area as well.
Any other comments by commissioners?
Mr. Shadwick here. Jason, would the city have to amend what they have on this mass gathering to do this?
The city didn't enact anything on mass gathering. They had talked about potentially a while back when we thought when I was thinking about letting the previous one expire, but no, with their mask order, it would stay in place, the same with ours, and then they wouldn't have to do anything with the mass gathering.
Okay. Thank you. Any
Commissioner
public
Vidrickson?
comment?
Commissioner Vidrickson,
Sorry.
do we need to enact anything here, Jason, or does your authority go beyond what we're talking about here? I mean, be able to just let you issue a health order and that's the end of it? Is that where we go, or because we don't have a
Right.
RFA or anything?
Right. So under my current authority, I can reissue the health order. Again, the commission, if they decided that they wanted to review, amend, or revoke the health order, then you would call a meeting or add it to your agenda for that additional action.
All right, I see. Has been my position for 4.5 years, or a little over 4 years on the commission. I'm going to continue to take my direction from the health department and the health officials, and if that's your recommendation, I'll hang in there with it.
Yes, sir.
All right. Any other comments? Any comments from the public?
Mr. Chairman, I do have a hand raised. Lene Meyer wishes to speak.
Lene, your name and address?
Lene Meyer from Saline, Huntington Road. I just want to say, as a citizen, it scares me that it's increasing from like 25% to 50%. That could mean a lot of people in some facilities, and I think people might be getting. I don't know if they're getting better with wearing masks, but with people not always wearing masks and following the guidelines, it scares me to see that increase at this point. That's just my opinion. My heart kind of jumped when he said that.
Okay. All right, Lene. Well, thank you. Any other public comments?
Mr. Chairman, no one has their hand raised at this time.
Okay. Well, Jason, thank you for your information this morning.
Thank you, gentlemen.